So our webinar this afternoon, certainly a topic that I am very interested in and have understand the challenge of this topic, taking care of cancer patients. So thank you, Melissa and Lisa, for talking to us this afternoon about using acceptance and commitment therapy to help cancer survivors move forward after treatment. Our first presenter is Dr. Holt. She recently started a survivorship clinic for cancer survivors with her colleagues Lisa Kanzer and Ellen Rubush. She teaches Finding Wellness After Cancer. These are wellness classes for cancer survivors. And she is fortunate to work with an incredibly talented colleagues with the Comprehensive Cancer Support Program. Our second speaker is Dr. Kanzer, who completed her doctoral training at the Florida Institute of Technology. She completed a postdoctoral fellowship in health psychology at the James A. Haley Veterans Hospital in Tampa, Florida. Dr. Kanzer joined the UNC faculty in 2021 and developed the Adult Consultation Liaison Psychology Service. So welcome, and thank you both for being here.
Thank you.
So here is a sample of what the Poll Everywhere questions will look like on your screen. If you can go there now to test it and make sure you're set up, you can practice with our first question, what is common concern for cancer survivors? And we will circle back to this in a moment. Here are our disclosures. So what is a common concern for cancer survivors? If you have your poll everywhere up, you can respond and it will show on the screen. So as we wait for some responses, I have a very long list.
Reoccurrence, that's a huge one.
Mm-hmm. Yes.
Financial security, for sure. Yep.
Scan time is always stressful.
Yes.
Yeah.
Yeah.
Everybody's focused on fear of recurrence.
Yeah, it's one of the probably number one concern we see with folks.
Yeah.
Burden on family for sure.
Yeah. How's this going to impact long-term functioning? Absolutely.
Yeah. It's usually a new normal, not getting back to normal.
Mm-hmm.
Yeah,
These are all great. Yeah.
Yes.
Mm-hmm.
Great, thank you. And we will hear more from our speakers talking about these. So I will turn it over to Dr. Holt and Dr. Kanzer. Thank you.
Thank you. So yes, using acceptance commitment therapy, which we call ACT. We don't say ACT, we say ACT, to help cancer survivors move forward after treatment. We don't have any financial disclosures. And our learning objectives for today are, first, we're going to describe psychosocial challenges faced by cancer survivors. And we're also going to identify core concepts of acceptance and commitment therapy, or ACT. We're going to explain how ACT can be used to address psychosocial concerns in cancer survivorship. So common survivorship concerns, we got some great ones just a few minutes ago. We all know that a cancer diagnosis and treatments are very stressful, and that when treatment ends, it's not uncommon for people to still feel stuck or struggle to move forward after treatment has ended. Patients share with me all the time how, while they're happy that their treatment has ended, it's scary to not see their oncology team all the time. They were used to making regular visits, and it was like some reassurance to be checked on so frequently. And so they're often, surprised that their distress is actually up after cancer treatment has ended. Fear of recurrence is huge. And that was obvious. Everybody knows that. Every little twinge of pain or discomfort can instantly cause someone to think that their cancer is back. And scanxiety is huge also. Oftentimes when someone is on the other side of treatment, they have to be monitored at regular intervals to make sure that their cancer is not recurring. So getting those scans every 3 months or 6 months or whatever it is, depending on your cancer, can be terrifying to patients. So leading up to it, patients often find that their anxiety is increasing leading up to the scan, and then also on the other side of the scan, waiting for the results to get back. So that's something we see a lot. Cancer survivors may look at life differently on the other side of treatment. They may have a different idea about how they want to live their lives. They may be unhappy with the physical changes that have happened to their bodies after treatment has ended. They may feel self-conscious or unattractive. It can really cause a hit to their self-esteem. And fatigue can be super overwhelming. And we all know that exercise is a huge help in combating fatigue, but it's hard to convince people who are extremely exhausted from what they have just gone through and to get them to go out and move their bodies. Cognitive changes are not uncommon. And it's oftentimes people have a hard time focusing on their jobs or their everyday life tasks. That all can be a new challenge for them. I've seen patients have to change their careers because of the long-term and late effects of their cancer treatments, such as peripheral neuropathy or the cognitive changes. If you're a surgeon, it's hard to do surgery if you can't feel your fingers. So oftentimes people have to rethink what they once were doing, which is not easy. The realities of cancer survivorship, according to the American Cancer Society, they came up with facts and figures for 2024. They're expecting over 2 million people to be diagnosed with cancer this year, which is the largest. The numbers keep rising and rising every year. And we're getting the cancer survival rate is continuing to improve because we're getting better at treating people with cancer. So more and more people are living with both the physical and psychological symptoms after cancer treatment. Post-cancer treatment effects such as anxiety, pain, fatigue, insomnia, depression, and fear of recurrence, it can go on for over 10 years, just no telling. And it's common for cancer survivors to perceive stressors as more severe than what they really are due to the fear of recurrence. And this can often lead to an impact on their mood and their physical symptoms. Now to Lisa.
Okay, so what is ACT and how do we think that this treatment model is particularly adept at addressing these psychosocial concerns in cancer survivorship? So ACT is a newer form of psychotherapy. It was developed in the 80s and it's considered a third wave psychotherapeutic approach. And what that means is that it incorporates interventions and skills that go beyond the more traditional cognitive models. It is considered a form of cognitive behavioral therapy. A key difference with ACT compared to other therapy approaches is that it is process-oriented versus outcomes-oriented. And what outcomes orientation typically refers to are treatment approaches that are really geared towards symptom reduction, right? Like we want to see a reduction in anxiety symptoms, or we want to see a reduction in depressive symptoms. And this approach isn't always the most appropriate for concerns in survivorship because a lot of times it's reasonable that folks are going to have more anxiety or an emotional response to their challenges. For instance, fear of recurrence. We anticipate that fear of recurrence will occur, particularly around scans, and we don't want to pathologize that. So a process-oriented approach is different in that the focus is not on eliminating symptoms, but rather helping patients change the relationship with their symptoms so that they're still able to live with a good quality of life and feel like they're able to move forward in a meaningful way. Okay, so ACT has 6 core principles, which are listed briefly up here, and we'll go through them in more depth, but they include acceptance, diffusion, self as context, contact with the present moment, or sometimes referred to as mindfulness, values, and committed action. And the overarching goal of ACT is to increase psychological flexibility. So psychological flexibility refers to our ability to adapt and respond effectively to life's challenges. At the end of the day, we know that pain and suffering is something that's universal, and cultivating psychological flexibility allows us to navigate life's challenges with greater resilience, acceptance, and the ability to focus on pursuing what truly matters to us.
So our first poll everywhere question, what is the difference between ACT and other forms of psychotherapy? A, ACT sessions can be completed in less than 30 minutes. B, ACT sessions help patients change their thoughts to be more positive. C, ACT is process-oriented versus outcomes-oriented. Or D, ACT involves uncovering unconscious factors that contribute to suffering. So we have some answers coming in. We'll give you all a few more seconds. How'd they do?
Yeah, 100%. So everyone's absolutely correct. So yep, again, ACT is this process-oriented treatment modality versus being outcomes-oriented. Well done. So we're going to go through each of those 6 core principles one by one, but just to give a quick overview of what each one is referring to, acceptance is acknowledging our experiences without judgment versus trying to control thoughts, suppress them, or change our experiences. Mindfulness, or contact with present moment, involves learning mindfulness skills to help patients be grounded in the present moment rather than caught up with difficult thoughts and feelings. So patients are taught mindfulness skills and asked to practice and track these. Then self as context refers to the principle in which we are helping folks learn awareness of aspects of identity that remain consistent despite our fluctuating thoughts and emotional experiences. Diffusion refers to learning skills to observe our thoughts and feelings from a distance, to really unhook from difficult thoughts and feelings that are taking over our mind and our attention. Values clarification is the process in which patients are guided to identify their salient values and assess how aligned they are with those values in their given circumstances. And last but not least, committed action refers to the process of setting actionable goals and taking actions consistent with values to help increase that alignment with values, again, regardless of circumstances that are going on at any moment in time. So that first core principle, acceptance. Acceptance refers to non-judgmental awareness of thoughts and feelings. This is often a very difficult concept for folks to really grasp, because there's this misconception that if we accept our circumstances, that means we're saying that we're at peace with them or that we like them, when that truly isn't the case. So rather reframe acceptance as truly acknowledging our circumstances as they are without judgment. And the reason why this process can be hard, again, is because pain is universal and it's natural to want to avoid any type of pain. However, sometimes our efforts to avoid pain and discomfort can inadvertently prolong our suffering or increase our suffering or take us away from the things that matter most. So some examples are procrastinating or excessive reassurance seeking, just, folks who might contact their doctors or medical teams incessantly because they just want reassurance that things are okay. But no matter how much reassurance they're given, they can never truly believe it. Avoidance behavior is just going to any effort to avoid feeling something uncomfortable. suppressing emotions, or even turning to things like substances, again, to try to briefly numb away any pain. So we use a lot of metaphors in ACT to help demonstrate these concepts and help get buy-in to why these concepts can be helpful. And a common one we use when we're talking about acceptance is the quicksand metaphor. So hopefully no one here will ever find themselves stuck in quicksand. But if you were to, a knee-jerk reaction might be to try to fight and claw your way out as quickly as possible, right? Unfortunately, the mechanism of quicksand works in that the faster and the harder you try to claw and climb your way out, the quicker you sink. So this is how we explain what avoidance is that the more you resist pain and suffering and try to fight against it and control these feelings, it's actually just taking you away from what matters most, and it's not helpful. So apparently, if you want to get out of quicksand, what you need to do is get very, very still and to try to lay down, get horizontal with the quicksand. And what this allows you to do is to rise up to the surface and then roll away to safety. And again, that's how we're describing this acceptance piece, is that if you can acknowledge the circumstances, not try to change them, sit with the discomfort, that will allow you to get to a place where you can make a choice to go towards what matters and where you want to go. So mindfulness, contact with the present moment. This refers to the process of developing non-judgmental awareness and grounding ourselves in the present moment so that we're getting out of our heads, off of autopilot, and into our present surroundings. So how do we do this? There are many different skills that we teach patients, and a lot of it comes down to personal preference and lifestyle, but a common one that we do for folks that can be done anywhere and doesn't take up a lot of time is a technique called dropping anchor. The idea being that if you find yourself in an emotional storm, you can quickly drop an anchor so that you feel grounded. And the acronym for this technique is listed on the screen, ACE. So the first step when you find yourself into an emotional storm is to acknowledge the thoughts and feelings that you're having. I am feeling really anxious right now. I'm feeling really worried about the scan I have coming up. Okay, this is a feeling of anxiety. And then C, coming back to your body. So that could look like taking a deep breath, pushing your feet into the floor, pressing your fingertips together. Again, it could be something really subtle, so subtle that if you're in a meeting or somewhere public that no one else is going to notice, right, what you're doing. But you notice you are doing something to physically ground yourself into your surroundings. And the last but not least, to re-engage in what you are doing, right? So what was happening before these thoughts and feelings carried you away somewhere else, right? Were you cooking dinner? Were you in a meeting? Were you in the grocery store? How can I refocus my attention and re-engage in what I'm doing? And again, pay attention to those senses. What do you see around you? What do you hear around you? That's how we get folks to anchor themselves in the here and now rather than getting caught up with shameful feelings about the past or worries about the future or whatever else might be going on in their mind at that moment. And then another principle includes self as context. And so again, this refers to gaining awareness that thoughts or feelings are experiences that we have and that we are not our thoughts and feelings. So really that difference there. We have thoughts and feelings. We are not just thoughts and feelings. And so our goal with helping patients understand self as context is that folks have a more stable sense of their self that transcends temporary experiences, like our emotions. They're all temporary, right? And so a metaphor that we often use in ACT to explain this process is called the chessboard metaphor. So this invites patients to imagine our thoughts and feelings like chess pieces, where all of our good, wonderful thoughts might be the wooden pieces that you see on the screen, and all of our bad, negative thoughts and feelings and experiences are the black pieces. And so if we're caught up in this game of chess, we're finding ourselves constantly trying to rid off all of our opponent's pieces, right? Trying to get rid of all the black, dark thoughts. However, the problem is that in life, there's always an array of pieces that are coming our way, right? We never get to a point where there's never any more challenges or negative reactions coming our way. And if we get so caught up in this game that we're only focusing on the battle, we're really losing out on everything else that's going on with our life. So the chessboard metaphor invites us to really take the perspective of the chessboard, right? It remains stable, undamaged, and unaffected by the game that's going on the board. It's a solid arena that is there regardless of the circumstances. And so, again, this metaphor really helps folks just rethink their experiences and their relationship with their difficult thoughts and feelings, of knowing we can remain solid and stable with ourselves, regardless of the array of chess pieces that we have in our lives at any given moment. And diffusion. Diffusion refers to unhooking from our thoughts and feelings. So using skills that we learn from self as context and from mindfulness, we can create space between difficult thoughts and feelings. There are many stories that we tell ourselves every single day, some helpful, some not so helpful, right? So a common one we hear with our cancer survivors might be something along the lines of, I should be able to do just as much as I was doing before cancer treatment, right? And this can often lead to feelings of guilt, shame, or just low self-esteem. So we invite folks to just pay attention to that as being a story that your mind is telling you and a thought that you were having, right? So I notice I'm having the thought that I should be doing more, or my mind is telling me the story that I should be able to do what I was doing before cancer treatment. And this helps folks create that space where then they can examine how helpful that line of thought really is, right? So how will telling myself this story, will that help me get closer to the things I want in life? And if the answer is no, then we can encourage folks to use a dropping anchor technique or a mindfulness technique. And again, then how do we recenter now and refocus and try to be grounded in the present moment and not get caught up with these unhelpful thoughts and feelings that take us away from what we want in life. So you see the picture here, we can imagine our thoughts really just as leaves floating on a stream, right? A stream is going to continue to flow as they will, and we can just place all of our thoughts, feelings, experiences, imagine putting them on a leaf and letting them float on by. We don't have to get caught up with every thought and spiral with every thought that comes into our awareness. And a key part of ACT includes values clarification and guiding patients to identify what their core values are and then using those values to guide their behavior. So our alignment with our values naturally shifts when we're going through challenging times. And if we're going through a particularly stressful time, often the first thing we cross off our to-do list are those things that bring us contentment or joy, right? That those then just become the luxury things, so to speak. However, taking inventory of our values and then really reflecting on how aligned we are with those values helps us recenter and refocus our priorities. And this is something that many cancer survivors are naturally doing, because going through an experience that's as devastating and distressing as cancer often just naturally brings up, how do I want my life to be different moving forward? Because I don't know if I want to go back to the way that I was living. I really want my life to be more meaningful. And so taking inventory of values is a step to help increase that alignment there. And then last but not least, committed action. So this involves setting and committing to actionable goals that are aligned with our values regardless of circumstances. So again, we make this plan with patients to be actionable so they have a very specific and concrete starting point. And we also understand that barriers and challenges will come our way. So we anticipate what might be obstacles that come up that might make this difficult for you to continue committing towards your values. And we come up with an action plan. So it really helps then folks feel like they have a path forward to move towards their values, and can increase that sense of meaning and purpose in this very unique phase of life. Oops.
So our next poll everywhere question. So telling yourself, my mind is telling me the story that this symptom means the cancer is back. is a form of which ACT intervention? A, mindfulness, B, cognitive diffusion, C, self as context, or D, contact with the present moment. We will give you just a few seconds. See if we have some different answers coming through.
So the answer is B, cognitive diffusion. And probably the key difference with this technique, so there's a lot of overlap with these principles, but really that piece of just noticing the thought, right? So, and that's that noticing it and diffusing from it. So my mind is telling me the story, right? So we're really aware of what the thought is, what the cognition is in that circumstance, and we're unhooking from it.
So why choose ACT? Cancer survivors can learn to acknowledge and accept cancer-related distress. They reduce avoidance of thoughts, images, and emotions. They can clarify personal life values and implement behavior changes that facilitate moving towards these values. And all of this leads to greater psychological flexibility, which is the overall aim of ACT. So, of course, we did research before. We knew we wanted to help cancer survivors. And we knew that, we see so many patients coming to us at the end of treatment with lots of anxiety, fear of recurrence, and depression. And we were trying to figure out what can we do to best help these patients. So a couple of the nuggets we found in our research, from the National Institute of Health's National Cancer Institute website, said that ACT can teach skills that can help cancer survivors cope more effectively with the emotional and physical changes that occur after completing treatment. And then there's also this great systematic review that we found on ACT, which was used with lots of adult cancer survivors, found that ACT significantly reduced anxiety, fear of recurrence, and depression. It improves quality of life and produces psychological flexibility. So just felt perfect for us. ACT helps survivors in figuring out what they can change by taking the specific actions consistent with their values and yet recognizing the parts of their experience that they can't change. An approach such as ACT that allows for distress is well suited to our survivors because their distress frequently reflects realistic concerns, including fear and reality of cancer recurrence, enduring treatment side effects, and the need to change major health behaviors, such as losing weight or stopping smoking. But basically, you can't take away someone's fear of cancer recurrence because their cancer might come back. Mm-hmm. And there's also when you've been through toxic cancer treatments, it's very possible that you could get a secondary cancer. So it's our job as healthcare providers to help guide people and to living, doing better health behaviors such as eating, watching their nutrition, moving their bodies, getting plenty of sleep, things like that. Basically, in a nutshell, ACT just turns down the volume of their anxiety and their fears and helps them focus on living in accordance with their values. It doesn't want to go.
I'm having difficulty moving it forward.
Yeah.
Let's see. Bear with us one moment. Oh, there we go. Thank you all. So we are moving on to our next poll everywhere question. Clarifying personal life values can be helpful in achieving greater psychological flexibility. True or false? We have 100% true.
Yay.
Yep, that's it. Okay, so Melissa and I are going to review two hypothetical patient vignettes to demonstrate how a course of ACT might play out for a cancer survivor struggling with that transition from treatment to survivorship, using common scenarios that we see with our patients. So first case vignette, we have Mr. Jones, a 65-year-old man with history of bladder cancer, and he is endorsing debilitating anticipatory anxiety about recurrence. And this has impacted his sleep, his appetite. He's having attention and concentration difficulties and feeling quite restless. And he's also reporting a significant preoccupation with his health, and he has some excessive worry about any uncomfortable or unusual bodily sensations that he has that typically brings on the thought, is this the cancer? Is the cancer back, or is it somewhere new? And he is frequently rescheduling his surveillance appointments as an effort to avoid feeling anxious. So how might ACT play out for Mr. Jones? Well, first, we would want to spend some time just normalizing his difficulties and talking about his fears of recurrence as his mind's evolutionary process of trying to warn him of potential danger, right? He's been through something really distressing, and now anytime he sees something that reminds him of that, it brings up this thought of, what if it's the cancer, or what if the cancer comes back? And helping normalize this experience helps him build self-compassion, which may make that acceptance of internal experiences easier. We also try to highlight how his efforts to avoid discomfort actually perpetuate his suffering, right? Rescheduling his appointments and really avoiding the medical system. Best case scenario, that's really not relieving his anxiety, because he's just sort of kicking it down the road. Anytime that new appointment comes up, he's still feeling just as anxious. But worst case scenario, it could end up having adverse outcomes on his health because he's not attending his medical appointments. So we'd want to really explore how those efforts to control aren't helping him, and see if he's open to trying something new, right? So teaching him about acceptance and those grounding techniques to help him acknowledge these feelings without judgment, get back to the present moment, and again, have that dropping anchor technique on here that we'd encourage him to practice not only when he's feeling anxious, but at other times as well. So he's just becoming more comfortable with this process of gaining emotional awareness and being able to bring himself back into the present moment when he notices those thoughts of anxiety starting to take over. And we'd also help him, using cognitive diffusion techniques, we'd help him unhook from these unhelpful thoughts and feelings. So we might use a metaphor called thoughts and feelings as hands, right? So we might say to him, imagine that all of your stresses and worries about cancer recurrence are your hands. And out in front of you are all the things that matter to you, your loved ones, your hopes and goals and dreams for the future. Now, if you're so caught up with these difficult thoughts and feelings that they're in front of your face, right, you can't see anything else, right? If that's all that your awareness are these difficult thoughts and feelings, you're missing out on everything else that's important to you in your life. And we wouldn't ask that he chop off his hands or anything, right? What we would say is, what if instead you just laid your hands in your lap, right? Those thoughts and feelings are still there, but isn't it much easier to see your loved ones now? Isn't it much easier to see all your hopes and dreams for the future? So we help explain we have to learn how to compassionately carry these experiences without getting caught up with them. So again, using these cognitive diffusion techniques, maybe saying, the story I'm telling myself is that I would never be able to get through a cancer recurrence. How helpful is that thought? Is that bringing you closer to these hopes and dreams that you have? And if not, then how can we ground and how can we refocus your attention on what it is that you do want to grow closer towards? And we'd also do values clarification. We'd guide Mr. Jones to identify his salient values and rate his alignment. So we could do this by just having him identify what his salient values are and then rating his alignment with them on a scale of 1 to 10. And it may be that in some areas he's feeling pretty aligned and that others, such as in this example, family and nature, that he identifies these are the areas in which I really want to focus my efforts to increase my alignment. I really feel like my life would have much more meaning and purpose if I was doing more in these areas. So then we would create an action plan to help increase his alignment with these values. And SMART goals are, which you may be familiar with, they're a tool that helps break down our larger goals into actionable steps. So instead of having a vague goal of, I want to spend more time with family, or I want to spend more time in nature, right? We create a goal that is specific, that is motivated by values, adaptive, realistic. He has all the resources that he needs and time framed. So the way this might play out would be, I will spend time with my grandson this Saturday morning planting an herb garden. It's very specific, and it's tied with his values as well. So we would hope that, Mr. Jones learns all of these skills and that he benefits from them. And we'd also want to talk about anticipating obstacles, right? And knowing that, again, life we anticipate will be challenging and obstacles will come our way. But we can identify strategies to proactively have a plan to overcome these obstacles. And so, for instance, often a big obstacle, which is often the reason folks seek our services to begin with, are negative mood or anxious thoughts or negative thoughts, self-defeating thoughts, whatever the case may be. And so then we talk about the skills that he's learned in treatment, the mindfulness skills, cognitive diffusion, grounding in the present moment, and having an action plan of how to know when you need to use these skills to help keep you moving forward towards your values. And also knowing there are other just logistical obstacles that come up as well, right? Like pain or physical discomfort, having an action plan of what to do on days where pain or other physical limitations might make it more challenging for you to meet your goals, right? Like if your goal is to increase your physical activity and you wake up and you're having a pain flare, how can we create an action plan so that you don't just give up? Right. And then other limitations like, bad weather or other things outside of our control that come up and throw a wrench in the plans is just being able to acknowledge that things will come up and we have to be a bit flexible in our goal setting approach and having some strategic ways in which we can practice that flexibility while still moving forward towards our values. And so now I'll turn it over to Melissa, who will go through our second vignette.
All right, Ms. Smith. She's a 35-year-old woman with a history of breast cancer. She had a double mastectomy. She had reconstructive surgery and chemotherapy. She has difficulties with her body image following her surgery and is endorsing significant depression and anxiety. She and her long-term partner of 10 years have broken up, and she worries it's because she's no longer attractive. She doesn't think he finds her attractive. She shares that she's eating all the time, stress eating, and gaining weight, which makes her feel worse. She has started isolating herself from her friends and her family. She calls out from work a lot and fears that she's going to lose her job. And she can't sleep for more than a few hours at a time. She's lost her motivation to work towards a promotion at work, which was always very important to her. So here I'm going to try to help her clarify her unhelpful thoughts and feelings. So asking things like, what judgments does your mind make about yourself, your body, or your mind, or your behavior? And she might say something like, I'm not attractive. My breasts feel strange. They're cold. They don't feel like they're part of my body. It's ugly not to have nipples. What stories about the past or future does your mind tend to hook you with? And she might say, he left me because of my ugly breasts. I'm going to be alone forever. And then what reasons does your mind give you as to why you shouldn't do the things that matter to you? And her answer might be, what's the point of moving forward if I'm going to be alone? And here we might teach things like normalizing the thoughts and feelings that are painful, and that we all try to get rid of our painful thoughts and feelings. And so, of course, the aim of ACT is to help reduce the impact of these painful thoughts and feelings and help her learn how to live the life that she wants to live. The key here is acceptance, and which means opening up and making room for these painful thoughts and feelings. We drop the struggle with these and thoughts and feelings and allow them to just be. It's not an easy skill. Mm-hmm. Here, we might explore with her what she's done to try to control the unpleasant thoughts and feelings. And she made comments to me like, I call out from work all the time. I don't want people to see me. I'm ugly. I stress eat. I'm gaining weight. I stopped hanging out with my friends. I smoke marijuana every day because it helps me forget about how awful I feel. All of this is what we call experiential avoidance, which is normal psychological process where we're trying to get rid of our difficult thoughts and feelings. And we know that when people have high levels of experiential avoidance, it leads to more depression, poor work performance, an inability to learn, lower quality of life, and sometimes drug or alcohol addiction. I'd want to teach her that trying to get rid of these feelings in the long term is only going to make her life worse, and teaching her about the power of mindfulness and how it can help people learn to pay attention to their thoughts and feelings with openness, kindness, curiosity, flexibility. And teaching a mindfulness technique such as dropping anchor, which Lisa shared earlier, is super helpful. So cognitive diffusion is where we learn to step back and detach from those unpleasant thoughts or memories. And for her, I would first start by normalizing what she's saying, that thoughts like these are normal when your body looks and feels very different. We all want to feel comfortable in our bodies. She expressed lots of disappointment to me about how, she thought that the reconstructive surgery was going to make her stay pretty, and she doesn't like the way it looks. This may help her feel like there's nothing wrong with her if you can just normalize that everybody wants to feel comfortable in their bodies. And we may get into a detective mode with her by saying, usually when our minds are saying things about our appearance, there might be an underlying purpose. What might these negative thoughts about your appearance be trying to help you get or avoid? And is it pointing out something that really matters to you? So providing the psychoeducation about increasing your psychological flexibility by changing your relationship with these thoughts and feelings and looking at them as either helpful or unhelpful, and then expressing we are not our thoughts and feelings, and we can learn to observe them from a distance without getting caught up in them. So practicing the mindfulness is huge. Maybe take her through the leaves on a stream exercise. Lisa talked about the leaves on a stream earlier, but I just want to say there are some wonderful YouTube videos. You can just Google leaves on a stream, and you'll get lots of choices. And you can hear the water running, and you can see the leaves going by, and you can it takes you through the whole mindfulness activity. It's wonderful. Help her to learn to say like, I notice I'm having the thought, or the story I'm telling myself is that I'm not beautiful. Consider assigning this as a homework where she can practice the mindfulness and notice her thoughts without letting those thoughts control her. So I'd also want to discuss her values and help her clarify what those are. Because we know that the values are what your heart's deepest desires are and how you want to behave and the qualities that you want to bring to your ongoing behavior. So with this patient, I would want to help her tap into the values of kindness, caring. I help her learn to use kind self-talk, kind imagery, and kind deeds. Self-compassion would be super helpful here. That she hasn't been able to acknowledge her pain and respond with kindness. Helping her to discover that her values, which values she feels disconnected from and which ones she feels aligned with. and asking her what it's like when you act on your values, when you show self-compassion, instead of letting all those negative thoughts about your appearance push you around. So we would do some goal setting, and you can just, every patient's going to be different on what is important to them, and it could be leisure, education, personal growth, work, spirituality, family, other relationships. And with this particular patient, we chose personal growth, and just choosing a couple of values that you want to bring into play here. And with her, she chose kindness. And as Lisa showed before about having a SMART goal, how it's important to have specific, motivated by your values, adaptive, realistic, and time-framed. And helping her come up with, a good goal. And she recognized that when she wakes up in the morning, she never has anything positive it's always negative thoughts and feelings, never anything positive about herself. And so she agreed that, and she felt like it was realistic that she could, when she gets up in the morning, every morning, to write down something beautiful about herself for at least a week, and to see if that changes the way she starts her day. So reviewing ACT with Ms. Smith, we're helping her to accept the thoughts and feelings and be present, and choose a valued direction and to take action. And there's our references.
Thank you both very much. This was really informative and helpful. So to the audience, if you have questions, please submit them through Poll Everywhere. We have a few minutes to talk with our speakers. So as you know, and Melissa gets personal calls from me asking for help with these scenarios. It says, bear with us a moment, but I will still talk with our speakers. And it's challenging as providers and as advanced practice providers. We see a lot of survivorship patients, and having these tools and really tangible scenarios and visual. I mean, I've been doing this for a really long time, and that was incredibly helpful to share that, because if I had it my way, I would clone the two of you a million times over. I think this whole idea is incredibly valuable, and taking the time to talk through that with patients. It's hard in a busy clinic, I get that, but I appreciate the things you taught me today to bring to these visits with my patients.
Yeah, a common question that survivors come to me is, do other survivors feel this way? That's, I think, one of the top questions I get. Am I the only one that feels this way? Do other survivors feel this way? And so I think, regardless of just your interface with patients, being able to normalize that, yes, this is so normal. Many folks feel the way you do. How could they not feel this way, right? And that alone, just, again, because I think these concerns are so prevalent, but yet there's not a lot of systems in place of how do we address this, right? In the medical setting, and I think that normalization piece goes such a long way, and that's anyone that worked with survivors, that sees survivors, any of us can provide that normalization of, yes, of course, it's okay that you're feeling scared to come back for your next scan. How could you not be scared?
Right. I haven't met a patient yet who doesn't have some sense of fear of recurrence, and needing to feel like they're not alone, that this is what cancer survivors have to process and go through. But yeah, what I love about ACT more than anything is that specific skill of being able to separate yourself from people really do get hooked. Like they can't think of anything else except for their cancer possibly coming back. And they like literally can't function in their jobs. They're not good partners in their lives. All relationships suffer. People recognize, wow, I'm not being a good parent. I'm not doing this right, because they really can't seem to move forward from all of that anxiety.
Yeah, we are having some difficulty with poll everywhere, so I will read them to you all.
Okay.
Thank you for being flexible. So how can ACT be used with cancer patients and clients who might have low insight regarding their inner experience?
Yeah, that's an excellent question. I'm happy to take it if you
Go ahead.
I think first it's really explaining, what is an experience, right? And helping folks understand. Part of that acceptance piece is helping folks really understand, what's the difference between an emotion and a thought, right? And so the nice thing about Act 2 is that it's not a rigid treatment. We can pull from other things. And so if a patient has really poor insight to their emotional experiences, I might start with something like a feelings wheel, which is literally a wheel that has your core emotions and then sort of more secondary emotions. And it sounds elementary, but many folks have found this so helpful. If they know they're not feeling good, but they can't find that label, as they can say, yes, this is what I'm feeling. I'm feeling this right now. So I'd say that, with ACT, we could really just focus in on first that acceptance piece of what is a thought? What is an emotion? What is the difference? And let's first label what it is that you're experiencing, right? And so, okay, when you're feeling this, when you're feeling anxious, how does that look in your body? How does that look in your behavior? How does that look with what you're feeling, to help them, again, gain a bit more of that awareness of what these experiences are and how they manifest for them.
Yeah, and just reframing too. Like if they're not able to verbalize exactly what they're feeling, and you can kind of get some nuggets from what they're saying and put words to it, and then like, yes, that's exactly right, is usually what you'll get.
Our next question is, how can ACT be introduced to a cancer patient who might not have experience with mental health treatment and therapy?
Lots of patients, in fact, everybody I've worked with so far has not ever had any formal psychotherapy before, or and oftentimes they've never had interface with mental health before. But just normalizing that is huge. If that is bringing any anxiety, that when you're on the other side of cancer, it's a life change. And you may be looking at everything a little differently. So let's just talk about it just.
A thought I had as a provider, I almost feel like I wouldn't tell them we're doing therapy.
Right.
When I think about some of those conversations that come in, or a patient talking about the worries that they have and feels like it's the quicksand. I love the quicksand analogy, and I think everyone can relate to that. And bringing that up to patients or family members in that moment, they're doing therapy, they just don't know they are, right? Or
I think Act 2 is just overall a non-pathologizing approach. Is, we're not necessarily giving you a diagnosis. There may be diagnoses there, but that's not really our focus. It's really a normalizing that everyone on the planet goes through challenging times. Of course, cancer and survivorship, we know these are challenging times, and most people need extra support when they're going through challenging times. And as Melissa said, it's very common that we are folks' first interface with the mental health system if they're coming to one of our offices. And that's really a nice opportunity to destigmatize and really, I think, expand what viewpoints had maybe been coming into therapy or what that might look like. But I think most people find it's not necessarily what they expected, right? It's not how you see in the movies, but it is much more natural and non-pathologizing.
And what we've been trying to do with our clinic is to make this a short thing. It's like, so we offer the acceptance and commitment therapy in 4 to 5 sessions, so that patients don't feel like they're stuck having to do this in the long term. What we're basically doing, and that's how I explain it, is we're just going to teach you new skills. We're going to teach you new skills so that you can deal with how messy life really is. Because it's not just cancer that's making life messy right now. Life is messy for everybody. Nothing goes by smoothly for anybody. But yeah.
And I appreciate you all bringing this topic up for conversation and sharing these skills and tidbits, because for this exact reason, for those patients that don't feel they want a mental health provider that you all get stigmatized with, but that us non-mental health providers can actually have tangible tools to support people. Additional question, since ACT, do you have a list of values or categories of values to help guide patients in values identification?
Yes.
There are tons. If you just Google ACT values clarification, there are a lot of different resources that'll come up and many different just worksheets that might have a list that you can circle, or there's a bullseye where they have different domains listed and you can sort of rate how close am I to the bullseye with this value, but tons of resources available.
Since ACT is a process-oriented intervention, does this mean it can only be used for long-term care with patients and addressing their psychosocial concerns?
Not at all. That's to what Melissa was describing, is that it can be used in the short term, because although it's process oriented, it is skills based and it's an active form of therapy. And so what we're saying is that the long term process is that, yes, life is messy and it will always be messy, and we're going to teach you some skills right now, and it can be in as short as 4 to 5 sessions. A typical ACT course might be closer to 10 to 12, but the goal being is that you learn these skills, that you feel confident in your ability to move forward and use these skills to get closer with what you want. And then you can discharge from treatment. And of course, every person is different. Some people might have additional goals and they want to stay in treatment longer. But the goal here really is to help folks feel that they can independently cope with the stress curveballs that life throws their way, not that they're in therapy forever.
Great, thank you. And are there ways to use ACT in brief or solution-focused interventions?
Yes, which is what we're doing. We wanted to be able to provide this gift of learning these skills to as many people as possible. We have so many, hundreds and hundreds of patients coming through, and we really want to be able to help as many people as possible moving forward.
And additionally, it seems like ACT uses a lot of psychoeducation, like with explaining diffusion or mindfulness skills. How can you use ACT effectively if a patient is resistant or declining permission to share psychoeducation?
Yeah, I think, if it's something that's being offered and they are saying, no, thank you, it's not something I want, then of course we always honor patient autonomy. And, it may be that we're using skills like motivational interviewing. Like, can you tell me a little bit about about why you declined, right? Is there something that's really uncomfortable for you? Just, I guess, getting curious, and because I'd be curious of why they're saying no to the psychoeducation. But at the end of the day, would just want to honor autonomy and let folks know these resources are here if you change your mind, that we're always open to giving you these tools, but we do want to honor where you're at and meet you there.
And I don't think it's necessary for everyone to walk away knowing exactly what diffusion means.
Yeah.
That's not what we try to do at all. In fact, I don't even use that word very often.
Yeah, we use it in this presentation, but not as jargony in real life. Yeah.
we make it it's easy for people to understand.
Yeah. Which is when the metaphors come in handy, because it's less jargony that way.
Yes.
Yeah, I am keeping those metaphors in my toolkit, so thank you. So thank you both very much for this really great informative webinar. Thank you to the audience for joining us. Also, thank you to the University Cancer Research Fund and the Lineberger Comprehensive Cancer Center, as well as thank you to the Lineberger Cancer Network team and our amazing telehealth team. Thank you to Tim, Benny, John, Oliver, Andrew, Patrick, Lindsay, and Barbara.